Hey everyone, sorry I'm a little bit late. My name is Dr. Kelly Peterson, also known as the Belly Whisperer. If you're joining today, I'm going to be on live on Instagram and my TikTok, so if you have any questions, feel free to put them in the Q&A box. But before we start, I wanted to talk about breathing and more specifically kind of do a little bit of breathing with you. Breathing is something that's involuntary, so a lot of us don't really think about it. Luckily, our bodies do that for us. And obviously there's importance with lung capacity, pulmonary issues, but a lot of us don't realize the benefits of breathing for our digestive tract, for our pelvic floor, right? For lowering our blood pressure, stress levels, anxiety, all of that. So when we practice the breathing today, we're going to be practicing diaphragmatic breathing, right? So for people that don't know what the diaphragm muscle is, imagine like a big umbrella or a dome-shaped muscle that sits between your thoracic or your chest cavity and your abdominal cavity. It separates that. When you inhale, the diaphragm muscle contracts and it will flatten down. And then when you exhale, it will relax and recoil up, which will expel air out of your lungs. So I want to talk about inhaling, exhaling. A lot of people ask me, should I breathe through my nose? Should I breathe through my mouth? What's best? When you're practicing diaphragmatic breathing, the goal for this is to breathe in through your nose and exhale or breathe out through your mouth. However, some of us may have asthma, deviated septum, nasal issues that make it difficult to breathe in and out of your nose. That's okay, but the goal is to be able to work toward that. A lot of us breathe really well with our mouth, right? Some of us may consider to be called mouth breathers, right? You sleep with your mouth open, you breathe with your mouth open. A lot of us don't think about that. Like, what are you doing right now listening to me? Are you breathing through your nose or are you breathing with your mouth? Can you breathe in and out your nose? Can you plug one nostril, breathe in through that nostril, and exhale out of that nostril? Can you plug the other side, inhale through that nostril, and then exhale? If you're having a hard time with inhaling or exhaling through one or more nostrils, you're probably somebody that breathes a lot more with their mouth, and you're probably carrying that with your daily activities, your work, your exercise. So it's really important to practice using your nose to breathe. It has a lot of different functions, right? If you've done yoga or if you've done different breathing practices, you can actually affect your internal temperature with breathing. You can stimulate the vagus nerve, right? Rest and digest, or parasympathetic and sympathetic activity. So it's really important to, when you breathe, think about how you're breathing. When you go through, if you're somebody that's bought my method or if you're considering buying my method, the first step is breathing, and we spend a lot of time just on the anatomy of the diaphragm, how it attaches to your skeletal muscles, your fascia, and its importance in like your overall health. So a lot of us don't realize when you breathe in and out, that affects not just, lung capacity breathing in and out, but also your posture, right? Those attachment sites onto your sternum or your rib cage, onto your lumbar spine, those have effects on your posture, on your back. So breathing is really, really important. Some of us may breathe really well in, so you'll take a big breath in. I want you to try that now. I want you to see, if you inhale, whether it's through your nose or your mouth, how many seconds can you do that, right? 1, 1,000, 2, 1,000. Are you able to inhale for up to 10 seconds? A lot of us typically can breathe between 6 to 8 seconds pretty well, but can you also exhale for 6 to 8 seconds? Can you breathe in, hold it, and then can you exhale? I practice this a lot, so I can go a really long time. When you do that, when you forcefully exhale, you can feel your abdominal muscles, specifically the transversus abdominis. I talk a lot about this in my method. You can feel that corset muscle contract. So when you're using maximal inhalations and exhalations, or forced inhalations and exhalations, meaning you're controlling it, it's not involuntary, you can affect the excursion of your diaphragm. Why does that matter? Well, it's important for moving our organs, right? People don't realize when you take a huge breath in, you can move your organs up to 5 to 7 centimeters. That's incredible. So if you're somebody that has restrictions or adhesions because of some type of surgery, a disease, an infection, right? Maybe you had a severe lung infection, or you have chronic bronchitis. Maybe you've had surgery and you have restrictions or limitations there. Using the breath can help to move those restrictions, along with moving the rib cage manually, doing stretches. So what we're going to do is we're going to practice some breathing, and then I'm going to talk a little bit about why breathing plays a role also in posture, with flexibility, with bracing, and so on, okay? So I'm going to scoot back so you guys can see my belly. Let me come back a little bit. Roll down my sweatpants. When you're breathing, if you can, you want to make sure you let your pants roll down so your belly is nice and soft, all right? I know, like, the urge is to want to, like, suck in, right? Everyone, like, suck in and, like, tuck your butt. But when you're belly breathing, like, lean back, let your belly go relax, nice and soft. It looks very attractive, okay? So just let everything hang out. When you do this, you're trying to see, when you take a big breath in, what moves. So you can see my belly moves, obviously, right? When I exhale, you can see my abs come in. Now, when you're breathing, are you somebody that's doing this? You can see I'm using accessory breathing muscles, right? This is my sternocleidomastoid or SCM muscle, my scalene muscles. These are accessory breathing muscles. When you use these, typically when you're sprinting, running, some high-level activity. But some of us breathe like this all day long, and that can lead to jaw pain, neck pain, headaches, restrictions. So you want to see, are you taking a big breath in and going, are your shoulders elevating up toward your ears, right? That's another issue that people have. You want to let your shoulders relax. You want to let your neck, your jaw, your face, right? Are you lifting your rib cage, right? Are you doing this? I'm flaring my ribs, right? So some people do that. Rib flare. And what you notice over time, if you're somebody that's a rib flare, it's going to change the shape of your rib cage and your posture. So this has a huge effect on your skeletal muscle. So be careful of avoiding those common errors: shoulder elevation, neck breathing, lifting your rib cage, okay? Or the one that I see most commonly is a paradoxical breathing, also called reverse breathing. So it's a little harder for me to do. But let's say, so instead of inhaling and really imagining that balloon or that diaphragm expanding down, and then exhaling, and everything shrinks, you're doing the opposite. So you're going, inhaling, and then oh, this one is so common. I think I have 50% of my patients do paradoxical breathing when I have that. It's something that is pretty common and really easily fixed with just practicing breathing. Another thing, what is your jaw, what is your tongue, what are your teeth doing when you're breathing? I know that seems weird, but are you clenching your teeth together? Are you breathing with your mouth wide open, right? The goal is, I tell people, when you're breathing, you want your spine, you want to be in neutral posture, neutral spine, everything in normal position. So what is resting or normal position of our jaw? That is where we have the tip of our tongue touching gently to the roof of our mouth, and your teeth will be slightly apart and your lips closed. So that's resting position. You can't see it, obviously, because my lips are closed, but again, tip of the tongue is on the roof of your mouth, your teeth are slightly apart, and your lips are closed. That is open packed or open position of your jaw, meaning your TMJ, your temporomandibular joint, those bones that are contacting together to create that joint, they're now open a little bit, so you're not getting so much compression in that area. Like I said, a lot of people suffer from tightness in their jaw, tightness in their pelvic floor, all of that. They tend to clinch. So breathing and all of that, activating your vagus nerve to help with that parasympathetic tone, rest and digest, can really help with that. So I just got a question. Should I be pulling my muscles up and in when I exhale? So great question. So you can think about actually pulling your belly. Like if I let my belly relax and I just want to, I can activate my transverse abdominis pulling in. So you can breathe in, and when you exhale, think about pulling your abs in, or you can just use your breath to do it. You don't have to think about it necessarily or really actively pull. It's a very small motion. If you're someone that's trying to do it and you find yourself like flexing or posterior pelvic tilting or trying to butt tuck, squeezing your butt cheeks, it's too much. Diaphragmatic breathing is gentle. Forced exhalation, yeah, you're forcing the air out, but you don't want to like brace everything. If you if you try to pull everything in too much, you're gonna light up your obliques, and those are gonna be something you don't want to use with diaphragmatic breathing. Yes, they're an accessory breathing muscle, but you don't necessarily want to activate those when you're using your breathing. It's more trying to activate that transverse abdominis, that corset muscle. And then another question. I have a DR, an ab separation, or diastasis recti, and it's something that hurts to even breathe like that. What do I do? Oh, yeah, that's definitely abnormal. If you're having pain at all with your diastasis, go see you can, depending on what state you're in, if you have direct access, you can go directly to see a pelvic floor physical therapist. If you don't have direct access with your insurance with the state you live in, then you may need to go to your primary doctor first, get a referral, and then you can go see a pelvic floor physical therapist. Some pelvic floor physical therapists also are only cash-based if they're a private practice, so you can go directly to them that route. It's going to depend on whether or not, you want to use your insurance or not, and depending on what pelvic floor physical therapists are in your area. Also, if you have a diastasis or an abdominal separation, a regular orthopedic physical therapist can also look at it. I specialize in pelvic floor and visceral physical therapy, meaning I do manipulation of the viscera, of the organs, of the fascia and the abdomen and the chest, pretty much everywhere, at all the viscera, as well as the pelvic floor therapy, right? Here is my cool model. So if you go to see a pelvic floor physical therapist, and as someone that does visceral physical therapy, that's going to be the best for you, because they're going to be able to do a lot more different techniques for your abdomen and your pelvic floor, which also may be related to something going on with your separation, especially if your separation was due to pregnancy, if you're postpartum. So I highly recommend that. But like I said, some of us are limited in the area that we're in, so just seeing a general orthopedic physical therapist will work as well. So sorry, I got one other question. Oh, no, we're good. So if you're just joining me, my name is Dr. Kelly Peterson, also known as the Belly Whisperer. We're talking about the importance of breathing. It's the first step in my method. It's arguably the most important. I mean, all of them are really important. Like, if your posture is really bad and you breathe really well, I mean, that's awesome. So, but we still need to fix your posture. So it's like, which one is better to fix first? I always think in the hierarchy of things, always start with breathing, then comes posture, then comes flexibility, tissue range of motion. Then once your tissues can bend and move, now it's strengthening. Do you have that stability, that strength, that endurance? And then from there, it's belly buddy, the last step of the method. And that's finding a multidisciplinary team. If you're somebody that suffers from pretty difficult autoimmune diseases, or something that's a chronic disease, right? Irritable bowel disease, celiac, Crohn's disease, endometriosis, adenomyosis, interstitial cystitis, PCOS. There's so many things. I could go down the list of all the different things that require a multidisciplinary team, but that's basically how my method is formatted. A lot of people have been reaching out to me about it, which has been fantastic. I've been getting really good feedback. Thank you, everybody. So I put up a new payment plan for $59 a month for people that can't afford the full package. So you'll just basically get the curriculum, what they call it, dripped, or basically every month you'll get the next step of the method. So there's that option for people that can't afford it. I highly recommend buying it all at once if you have the resources for that. But basically, you're gonna spend anywhere from 1 to 2 weeks on each of those five steps, and you may find that once you're going through the program, you spend a month just on breathing because you feel so good at doing it. It changes all your symptoms. Your better bowel movements, better digestion, your low back pain is gone. And then maybe you work on posture, and then going into the flexibility. Maybe you reach the flexibility, the belly bending section, and you're watching all the videos, and you're thinking, wow, I'm already really flexible. I already do tons of yoga. I do tons of stretching. Well, maybe you actually need more stability. A lot of people that suffer from chronic constipation or prolapse, leaking, pelvic floor issues, they have really, really weak and stretched out abdominals. The tissues have been compromised. Maybe you've had a separation. Maybe you have had a hernia. Maybe you've had surgery and you have some scar tissue that's limiting movement of the diaphragm, movement of organs, muscle activation. So belly bracing and core exercises is honestly one of the most underrated workouts. A lot of us love to do the high level workouts, right? Like HIIT workouts, jumping, plyometrics, spin class, running, all of that. And it's fantastic. But don't forget the foundational core exercises that keep your spine healthy, right? Keep you from developing scoliosis or bad posture, hunched forward, forward head. A lot of the habits and the postural habits that we do every day actually can be causing us injuries down the road. It's a repetitive micro trauma happening. And then one day you wake up and you're thinking, gosh, my back hurts. And it just never seems to go away. Well, maybe it's the fact that you for your job, you're required to sit 8-10 hours a day and you never stand up during that time. Your spine is already going towards stiffness, unfortunately, as we age, right? Another good question. Does it help for diastasis recti? I'm having such issues. Yes, I treat this all the time. I don't even know how many patients I have with this right now. Maybe, I don't know, I have a lot. But it's really common, very treatable. Now, if you're somebody that has a huge separation, like you can stick your whole hand in there, it's a giant gaping hole basically, or you have a huge doming or coning, you have a ton of abdominal pain, it's affecting your digestion, it's affecting your bowel and bladder habits, you're having severe back pain, all of that, and you've tried, the conservative treatments, physical therapy, you've tried a few different therapists and you're not finding any relief, then yeah, maybe you need to talk with a surgeon about going in there and repairing some of those, separated tissues. However, if you're going in for the cosmetic reason, if you just don't like the appearance of it, when you go in, just be aware that there are risks when you get any surgery, right? If they sew you up really tight, if you decide to get, I hate this term, but mommy makeover, I don't think moms need to be made over. I just think, your body's going to change as you get older anyway. But if you are wanting to get a tummy tuck or you're wanting to get things tightened up, that's fine. Just be aware that if they tighten up this, now that it was really loose and they tighten it up, just make sure you do therapy after so you make sure that you don't have that separation occur again. Because what I find with a lot of my patients, especially my patients that get hernia repairs or prolapse repairs, anything with a mesh put in to support something, a lot of those patients actually re-injure it, some of them within the first few months, some of them within the first 1 to 3 years. And a lot of it is because they didn't have core strength to begin with. They didn't breathe properly. They had poor body lifting mechanics. So, of course, when they went to go do laundry, it ripped right open and their mesh completely ripped. So that's something to be aware of. If you haven't tried physical therapy and learned all of those kind of postural or activity bad habits, if you haven't changed some of those, if you get surgery, you may just re-injure it again. So, or if you're somebody that's had their first child and you've had a separation, just be aware with your subsequent pregnancies and deliveries that may stretch out again. So maybe you want to wait until you're done having kids. So there's so many things. That's why when people ask me these questions online, they're personal questions, there's so many factors that go into what should be the right treatment for you. Ultimately, what I tell people is go see a pelvic floor and visceral physical therapist, get a one-on-one with them, give them your whole medical history, everything, because sometimes treatments can be super easy. Sometimes somebody comes and sees me in person and I see them for one visit and they email me back, I'm great, I'm having sex, I don't have any pain, my husband's happy, I'm happy, and they don't come back. And that's great. That's the goal. If I can get you better in one visit, fantastic. So everybody's different. Some people may need 6 to 8 treatments, right? Maybe you need 6 to 8 weeks. So I had an inguinal hernia in 2007 that has 2 mesh patches. Yes, inguinal hernias are very common, right? Umbilical hernias or belly button hernias are common. Incisional hernias where you've had maybe a scar or you've had surgery and you've had, now the tissue is compromised, so you can get hernias there. Hiatal hernias are also very common. So that's great. So you obviously, sometimes the reason that hernias require surgery is if you're getting compromised blood flow to a certain area, that can cause a lot of issues, right? You can get, so you want to make sure if you suspect that you have a hernia, make sure you see a doctor and make sure they rule out that you don't need, that surgery is not something that you necessarily need, or see a physical therapist, have them do an assessment, see if they can help release some of those tissues or help with breaking up some of that scar tissue. So yes, awesome. So that's good that surgery worked for you. Okay. Another question, having a vaginal delivery after a rectocele, cystocele prolapse with my first baby. Oh, can you do it? So having a vaginal delivery after rectocele and cystocele prolapse with my first baby. So rectocele is prolapse of the rectum, right? You know, I am so sad. I lost half of my rectum, but here's my little baby rectum for my model. So when you're talking about a rectocele, basically your rectum has prolapsed out of the anus, right? It can be partially, right? There's different degrees, 1 to 4. When she's talking about a cystocele, that means that her bladder has prolapsed out of the vaginal cavity. So when you get prolapse, I don't have my medical diagram here, but what can happen is if you have a rectocele, like imagine if, let's say this is the backside here, and this is vaginal opening, rectal opening. Sometimes the prolapse can push into the vagina, and that can cause a lot of pain, a lot of issues, constipation, difficulty, right? Same thing with the bladder. You know, prolapsing, you think about it going downward, but sometimes it doesn't just go down, it goes back, it goes a little bit forward, right? There's anterior and posterior prolapse. So can you have a vaginal delivery after you've had those? Yes, you can. It's just going to put you at a higher risk for having that prolapse be more, right? The degree of which you've had that descent, right? If normal resting is 0, then now maybe you've gone from a 1 and now, okay, you have a grade 1 prolapse. Maybe it's gone to 2, right? 3 is, okay, it's starting to push past the opening. 4 is, oh no, it's fallen out. So you just want to be careful with that. It doesn't mean you can't necessarily have a vaginal delivery. It just means you're going to be at higher risk. And that's the same for anybody, whether you're with subsequent pregnancies, you're at a higher risk for having diastasis, prolapse, all of that. So really important. Okay, so before I go, we're doing good. Okay, got about 5-10 more minutes. If you have any more questions, these are awesome questions, put them in there. But if you're somebody that is suffering from any type of chronic abdominal pelvic issue, if you think your core is really weak, if you've got leaking, incontinence, if you suffer from painful penetration or an overactive pelvic floor, difficulty with putting in like a tampon, if you're somebody that has a low back pain or sciatica radiating down, if you're somebody that has food allergies or why am I bloating, why am I having all these issues, suffering from difficulty breathing, pressure on your chest, so many things. If you're somebody that's been trying to get pregnant and you just haven't been able to, you really want to look into doing my method. Also going in and seeing somebody, but there's so many ways that working on breathing, flexibility, strengthening can help with that. A lot of people think that they have infertility issues when they go and see their endocrinologist or they go see a reproductive specialist and they have all these tests done. They don't have anything that is actually inhibiting them from having a baby. So maybe it's just fascial restrictions. Maybe it's just restrictions in the fallopian tubes, right? That's why I tell people, go see somebody that does visceral therapy. Have us check your uterus. Have us check in these areas. Do you have restrictions? Are you breathing down into your openings? So important. Somebody said, just joined in. Can I still get pregnant with prolapse? Oh, 100%. You can still get pregnant with prolapse. So, and it, like I've just mentioned before, you missed, if you already have prolapse, just like anybody else with subsequent pregnancies, you're at an increased risk for making it worse, along with being more weight, right? If you're somebody that's has a little bit of obesity, that's going to increase your risk for prolapse or getting an abdominal separation. So those are things you can talk with your OBGYN and your gynecologist. They'll explain those risks too. But yeah, if you have prolapse, you can still have vaginal delivery. All right. So really good questions. You guys asked really good questions. So everybody's homework, if you're just joining, the goal of today is making sure you know how to breathe properly. If you are somebody that is holding your breath, if you are a mouth breather, if you can't fully inhale and exhale, if you have a hard time activating your transverse abdominis using your breathing, if you suffer from constipation, painful penetration, difficulty with orgasm arousal, look into my method. There's so many great tools for working on this. Where are you located? I have an office in Irvine, California. I treat in it's in Orange County. I treat in-person appointments on the weekends, and I also work at a clinic 4 days a week, Tuesday through Friday in Huntington Beach. But for my belly whisper, that would be in Irvine. If you're interested, you can book online. I don't require for in-person appointments. You don't need to pay ahead. You just have to make the appointment, and then I verify the information, and I give you the address. So yeah, please look into that. I have DR and I think a hernia, but I'm not done having kids. Should I wait to fix it? Oh, you must have just dropped in. I just answered this. The short answer is most likely yes, as long as it's not causing you any like bodily harm, depending on the type of hernia or the type of separation. But typically you'd want to wait until after your pregnancy, because everything can stretch out again, and basically you may need the surgery again especially if you're somebody that's fixing it for more of the aesthetic reasons, versus some people that just they have so much pain and issues because of it. So the degree of the separations can vary for everyone. I have a really good webinar. Oh, I forgot to mention, I have a webinar on this. Oh, close by. Awesome. Yeah, check me out. I'm treating people this Saturday. A lot of the appointments are already booked almost, but there's still some openings. So check on my link in my bio, and you can schedule an appointment there. What was I going to say about, I have a 52-minute recorded webinar that I did on diastasis recti and hernia, how to assess it on yourself, how to treat it, different ways to activate your core. Look into it. It's on if you go into my bio and you click diastasis recti webinar, it's right there. So yes, it can heal without surgery. So here's the thing. When people were getting a little pissed off, I think, in some of my videos, because I say, oh, can you fix the hernia? Well, that's more just saying, like, there are treatment options that you can do for it. Like, if you have a huge separation or coning, or you have a hernia and you're just living with the pain or the issues, there are so many ways that you can work on it. I treat this all the time. But some cases are super severe and require surgery. Some people just want to get the surgery for the aesthetic reasons, right? They don't like the way their stomach looks. They don't like that separation. So you really want to weigh in those factors. If you're just getting the surgery to just look a little bit better, then just make sure you're aware of all the risk factors. But yeah, things can heal. During your pregnancy, your belly will expand as the baby grows, and what happens is the linea alba, that's where the rectus abdominis muscle attaches on right here, right? What happens is the rectus abdominis muscle basically separates, right? It depends. It could be here, it could be here. There's different locations, but it has the propensity to heal and grow back after you've delivered the baby. But a lot of people don't realize that, and a lot of doctors, unfortunately, do not send women to go see a pelvic floor physical therapist at the 6 to 8 week checkup. I mean, there's people that I work with postpartum within the first 2 weeks that I give gentle breathing exercises and talk to them about posture. There's so many things you can do. So the goal is just letting people know that you don't necessarily, need to live with these things. There's so many treatment options, and it's never too late to treat it. If it's been 6 years, 20 years, it doesn't matter, because ultimately, as you age, we're like cars. Our bodies are going to break down. You're going to need maintenance, right? You're going to need a shoulder replacement. You're going to need a knee replacement. You're maybe going to need a rotator cuff repair. But if you can get your core stronger, if you can keep that stability and keep it healthier longer, maybe you won't have as many injuries or issues down the road. So it's never too late. Please look into physical therapy for your separation. There's so many things we can do for it. Like I said, I treat it all the time. So yeah, check it out. And then also, if you are curious about my method, you can go on either of my websites, bellywhisperoc.com, or you can go on my thebellywhisperer.com teachable website, and you can sign up to either newsletter. I give out discounts, and I let people know deals ahead of time, so you want to look into signing up for that, because I'll be sending something out later today. So, but yes, awesome. If there are any more questions, oh wait, let me check one more. I had a diastasis. I did PT for 10 weeks. Can I do regular abs and work out now? I have no idea. Yeah, I have no idea about that, because just because you do PT, I don't know what you did, and I don't know if you're strong enough, and it depends on what core exercises you do. Some people do really high level stuff, so you want to be careful. I tell people, if you're doing any exercise and you're having any pain, if you feel any pulling, any heaviness in your vagina, those are all bad signs. You don't want that. That means that the exercise is too high level for you. So be aware if you're working out and you're feeling pain in your back, or you're feeling pressure in your pelvic floor, it's causing you to leak. Those are red flags. You want to make sure you back off that and modify the exercise. It's too advanced. Or see a physical therapist, like I mentioned. So, yeah, check it out. Like I said, my method's on sale right now for the end of October. It's normally $3.99 and it's only $2.50. And there's also a $59 a month payment plan for people that don't have the resources for it right now. I'm also looking on adding a gift card option. I've had a lot of people ask me if they can buy it for a friend, so I'm going to be going on the website today and adding that. So if as the holidays are coming up and you want to buy this for your sister or your brother, your dad, your mom, I'm going to try to add that gift card option on my Teachable. But yeah, thank you guys. If you are somebody that's looking for help and there's nobody near you, I offer online appointments as well. So look in my bio. I'm also thinking too about offering a new thing. I just thought about it the other day, where if you decide to pay for my 30-minute consultation or a 30-minute appointment online, if you want to then transfer that to the method, I will then take off that $50 that you spent buying that appointment. So it is kind of a nice thing, because then you can talk to me one-on-one. We can focus on what you need to do during the method and what are the areas that you need to recover from. And if you don't want it, that's fine. There's no obligation, but I'm going to be adding that within the next 1 to 2 weeks, so keep an eye out for it. But yeah, thank you everybody so far who has bought it. Like I said, the feedback has been incredible. I created it for people that aren't local, because when I started this Instagram, I didn't think it was going to blow up as much as it did. And I'm really happy that people are interested in what I do, because to me it's normal and I do it every day, and I didn't think it was that unique. But now that I'm hearing that a lot of people need help, I created this method so people that are out of the country, that are abroad, that aren't in California, you guys can now treat your stomach at home, okay? And I know I mention this a lot, but a lot of you know me, I have had a lot of gut health issues. I have gone through a lot of the same things that people have gone through, being misdiagnosed, having, unknown bloating, stomach pain, not realizing it was something more serious, and finally, getting help and getting on that right path and really understanding how my body works. It's been life-changing for me. So that's the goal with this method, is to help you out. Also, I forgot about this. I have been meaning to put up a PDF online that gives you hyperlinks to finding a pelvic floor or a visceral therapist or a doctor. Basically, how do I find somebody to help me, right? I have this included in my method. If you buy my online program, it comes with one of the handouts. I think, I have 5 handouts and it's one of those, but I'm going to try to add it online, because I get so many people that ask me about, how do I find somebody near me? So I want to give that resource out for free. It's just basically different websites and search engines. Hopefully I can get one going with my method to help people kind of find out more. Also, if you're a medical professional, I offer a discount, and you can get a little bit of preview of the courses and the videos that I offer during my method. Message me about that if you are a medical professional and interested in that discount, or if you're looking to buy a bulk group of packages for your clients. Please reach out to me. I do offer that. And if you have any more questions, like I said, book an appointment, email me. Try not to message me personal questions, because I can't answer them without more information. So I would love to help everybody, but just make an appointment. I'm really busy. I work pretty much 7 days a week. And like I said, 4 of those days are in the clinic, and the other days are in person and online. So it's really